episode number 31. Red, white, and blue light. Healing or hype? Well, does red light therapy work? Is the morning sun good for you? Do blue light blocking glasses help your sleep? What do we know based upon real evidence, and what works and what doesn't? That is today's episode. So join me. Well, why am I wanting to talk about this topic? Well, when I was a child, a bit ago, I had atopic dermatitis, or at the time we often called it eczema. And my feet would have real problems, cracked skin, itchy. It was a mess. Went on for a number of years. And I remember going to the dermatologist and him saying to me, well, go out in the sun and stick your feet up towards the sky, and that may help your symptoms. And in fact, it really did help. So I remember that. My daughter recently has been going out for early morning walks and getting sun in the morning, and she's finding benefit for her in all sorts of ways, especially her sleep. My wife, my dear wife, Gail, wears blue light blocking glasses at night before bed to help her fall asleep. And almost everywhere you turn, there are advertisements for red light therapy boxes with claims about all sorts of things they can solve. So why not talk about light and light therapy? Let's go down the rabbit hole together and learn about white light as therapy, red light as therapy, and whether blue light is bad for you. Now, the timing is really, really good because we recently talked about placebo. That was episode number 28. And many of the benefits that people might claim from a red light therapy, frankly, maybe the placebo effect. And if you want to re-listen to that episode to remind yourself about all the ways that placebo can be powerful, feel free to do so. And the N of 1 approach, which was episode 27. And we're going to end today's episode with how you might test out these approaches for yourself. Keep in mind that whether you get excited about red light therapy or these other therapies, whether you get confused by the information, whether you think it's just the perfect way to dial in your health, that may depend a lot on your health type. And remember, we've got that quiz, the health type quiz, where it will tell you which type person you are and send you information about that. Feel free, if you haven't done it already, or do it again if you wish, go to my website, drbobbylivelongandwell.com. All right, my approach for today. I'm going to begin where the evidence is strongest, where we see that, in fact, it's been tested. It's been tested quite rigorously, and we can believe the results. And then we're going to work our way towards areas that, frankly, the evidence is much more scanty, and I'm not convinced by it. When we think about light therapy and we think about where it might benefit us, if it's the skin that we're trying to deal with, whether it's a skin disease or cosmetic issues, there is some evidence to say that light therapy works. However, if we're starting to say that light therapy can, cure headaches and reduce your risk of dementia and solve pain all across your body, that's issues that are deep inside you, and light really doesn't penetrate very far. So here, I'm much more skeptical of the evidence. So we'll talk about that. All right, the first area where, in fact, there's some pretty darn good evidence that light therapy works. In this case, we're going to begin with white light or sunlight. And sometimes that actually are light bulbs that are ultraviolet. But it's all about kind of the white light, total light spectrum. Now, I mentioned earlier that for me, it seemed to help for my atopic dermatitis or eczema as a child. Well, nowadays, obviously, they use more powerful lights than just the sun. And before there were these new psoriasis drugs and wonderful atopic dermatitis and other drugs, light therapy was really the mainstay. It goes back 100 years for psoriasis, where they put a tar-like substance on you and expose you to light. So it's well recognized, has been used for a very, very long time, and the American Academy of Dermatology guidelines support light therapy for these kinds of things. And as I mentioned, nowadays, we use ultraviolet light for some of these skin disorders. Also, if you have acne, these light therapies, white light therapy, ultraviolet therapy, can be very effective. But now here's the wrinkle, and there's going to be a lot of wrinkles that we're going to talk about today. Yes, light therapy can help your acne, but it's no better than benzoyl peroxide. And frankly, sitting under a light for quite a while is a burden. Now, you may not want benzoyl peroxide on your skin, but it works, and it's a quicker way to deal with it on a daily basis. So just keep that in mind. So when we think about light therapies, yes, it's important to say, compared to placebo, does it work better? Okay, but there's another question, which is, are there alternative therapies that are just as good, if not better? So light therapy may not be the panacea. Now, in one area, there's almost no alternative to good light therapy. That's for a type of depression called seasonal affective disorders. Now, this has actually only been recognized back in the 1980s. I would have thought this had been known about for, a century or more. But people who live in cloudy environments, think of the Seattle area or, Sweden or someplace where maybe it doesn't have a lot of sun, especially during the winter months, folks get depression. Folks who are sensitive to this issue. So the sunlight or the lack of sunlight brings on their depression symptoms. And lo and behold, if you look at a summary of 10 randomized controlled trials, being exposed to light therapy for 2 hours really improve their depression. Not just for those with seasonal affective disorder, but general depression as well. Now, I said earlier, we should be skeptical when we're trying to have an impact deep in our body. And obviously, depression is something that's going on in our brain. And how could this sunlight or white light therapy penetrate deep into the brain? Well, we're not asking it to do that, because what happens is the light goes in your eyes. Your eyes are connected to your brain, and that stimulation appears to be the way that it improves your depression. So keep that in mind. Now, as I mentioned with my daughter, going out in the morning and exposing to sunlight has helped her sleep. And it's not just an anecdote. There's been many studies that show that getting light in the morning helps to set your circadian rhythms and set you up for a day of feeling well and a night of good sleep. Now, getting light in the morning is one of 12 things that I've talked about in episode 3 to improve your sleep. So there's 11 more. If you're having troubles with sleep, by all means, listen to that episode or go to my website and read the blog, and it will list all of them, and try them all that you wish. It's felt that the light in the morning helps our biologic clocks, as I mentioned, and it has an impact on our melatonin levels. Now, more about melatonin levels in a little bit when we talk about blue light glasses. And finally, being out in the sun improves vitamin D production. So there are many areas that light, sunlight, ultraviolet light help us, and the evidence is really pretty good. But all the things I've talked about were because they were focused on improvements in the skin, which is very, very not deep in our bodies, or it went through the eyes. Now we're going to move into red light therapy, where the evidence is much more uncertain. Now, I went on Amazon to see, well, are there a lot of red light therapy boxes or options out there? Amazon has over 2,000. So everybody's trying to sell you a red light therapy, red light box, red light contraption that will help improve all sorts of different things. And it's been touted for hair growth, skin problems, pain relief, arthritis, cognitive function, and many more. So a high-level questions to ask yourself. Is it biologically plausible that a red light therapy box could be helpful to you? And we'll talk in a moment about how deep the light goes and can it work. Also, keep in mind that many of these studies were done in dermatologists or others' offices, and they're not using a simple red light therapy box from Amazon. They're using lasers. Now, lasers are a lot more intense, a lot more focused, and benefits that are seen from a study in a dermatologist's office are not the same as what you might do at home, where those devices are broader spectrum, not as focused, and certainly nowhere near as intense. Okay, so if you use one of the sort of home devices, the red light that comes out of them goes in maybe 1 millimeter to 3 millimeters, so a really tiny amount. So that should then raise the question, could it really affect us deep in our bodies? Yeah, maybe it affects our skin, but how about deep in our bodies? Now, if you go to a dermatologist and they're using a low light therapy with a laser, well, that can go in 1 to 3 centimeters, so maybe 1 inch or so. So that might be more effective, but it's not going to go deep inside your body, so keep that in mind. Okay, in the lab, and as my listeners know, I'm not real excited about lab data. I want to see what happens in people. But we'll begin, at least for the moment, about the lab. So if you take cells and you put them in a lab and put them in a petri dish or a test tube and you blast them with light, what happens? Well, you can show that the mitochondria, those little energy powerhouses in our cells, become more active and they produce more energy, ATP production. And you can show that if you take cells and you expose them to light, yeah, some collagen is produced, and collagen can sort of make the skin more young-like. So that makes some sense, but again, this is in the lab where you're blasting these poor little skin cells. But what about in people? As I've alluded to a couple of times, the data in general is better about impact on the skin. So red light therapy has been shown to improve wound healing. So chronic wounds that are not getting better for one reason or another, there's data to suggest that red light therapy works. But again, this is that low light laser therapy, not something you get off of Amazon. And it does seem to work. The other area, and this one actually can use some of the things you could buy over the counter, and that's hair regrowth. And there's been about 7 randomized controlled trials that showed some benefit. Now, these are very small studies, and many of them, as you wouldn't be surprised, have been done or funded for by the companies that make them. But there is some suggestion that it improves hair density. So here's an example of just one. So there were 60 patients in a randomized control trial, and they wore this red light helmet, so something that goes over your head, and people had to do this for 16 weeks. So it's a big investment of time and money as well. Now, on your head, the way they tell how your hair is doing is they count the number of hair follicles in a centimeter squared, so a small area of your head. And normal is about 200 hair follicles in that small space. Obviously, as you lose hair and become bald, that number 200 falls. So in this study, they looked at people that had about 42 hairs in that square centimeter. And that was their baseline. after the 12 weeks of using the helmet, that increased to 110. So in this one study, it didn't take people back to normal hair, but it took them in a very positive direction. Is this going to be true for you? Who knows? Are there alternatives that you could do that might be just as effective? Sure, but this is one modality that might have some benefit. And we'll talk at the end about N-of-1 trials and how you can test out some of these concepts yourself. Well, what about the skin itself? Wrinkles. Now, there have been some studies about whether red light therapy improves wrinkles. These have typically been really small studies, 10 people, 20 people. And they're typically done, again, by the companies that make the devices. But in one study, they looked at 20 women, and they looked at how deep the crow's feet were, the wrinkles around their eyes. And they looked at skin firmness and the elasticity and smoothness. And they did show some improvements. But as I mentioned here, one of the authors was from Parfum Christian Dior. They're in the business of focus on wrinkles. So you have to, again, take that carefully. Another study, a bunch of patients in a randomized controlled trial, they took photographs and they asked people to analyze the before and after photographs. And again, it was done by folks that make the device, but they did show some benefits. All right, so for skin, there is some suggestion that red light therapy can help. Now let's go deeper in the body, and this is where the evidence gets trickier. How about arthritis, pain disorders? Can it work? Can it work better than the usual things we would do? So there was a study, a meta-analysis of 22 randomized controlled trials for osteoarthritis. That's the typical arthritis of aging. And they tested red light therapy for a week, 5 weeks, up to 12 weeks. Some of them were done. And they did show pain improvement. Okay, so Dr. Bobby, it could work for osteoarthritis. Well, there was another meta-analysis of 5 studies for rheumatoid arthritis, a very different type of arthritis. And it, too, showed some improvements in pain and morning stiffness and some flexibility improvements in the hand. But this is where these studies start to get tricky. In that rheumatoid arthritis study where they showed benefit not only in the hand that had the laser light or the red light, but in the other hand as well. How could that possibly be? We know that it only penetrates a small amount. We could potentially see how it could help the hand that you were receiving the therapy with, but the other hand, so that begins to raise questions like placebo. Is that really what's going on? And there was another rheumatoid arthritis meta-analysis which showed no benefit. And finally, what about fibromyalgia? This is a disorder often related to poor sleep. They're connected, where you have a lot of aches and pains and what are called trigger points. And so this study looked at 9 randomized controlled trials in about 300 people, and they did show improvements with red light therapy. But in this case, this was the laser light. So again, something you would need to do in a doctor's offices. But what they found was, yes, there was some improvement in discomfort, but it was really no better than exercise. So yes, there's some suggestive evidence of light therapy helping, but when you look more carefully, you find there are problems with these studies. There are those that tout that red light therapy can help body contouring and weight loss. And in one interesting study, they took photographs of their abdomen. And one side, they gave the low light laser therapy. Again, this is the thing you would have to do in a doctor's office. And the other side, nothing. And they took pictures of each side. And then in a blinded way, doctors looked at them Guess what? There were no difference between either side. There's finally some thoughts that maybe it could help your cognitive function. These are, again, tiny studies conducted by the device manufacturers, and I'm not impressed with them or the results. So, as we think about red light therapy, do we believe the evidence? Well, some of it, yeah, it makes sense if it's, in the skin areas. As we go deeper in, I'm not sure I believe the evidence. Secondly, are the home units even strong enough? Because again, many of these studies were done with the low light laser therapy in doctors' offices. And there's so much confusion about, well, what's the right intensity of light and how long and what wavelength? And then finally, of course, is the issue of safety, and you would want to cover and protect your eyes, and there is always possibility of, sort of sunburn of your skin. All right, let's turn to the last topic, which is blue light, and whether blue light glasses that block the blue light are helpful in your sleep. Now, here's the theory. Theory is that your body, over the course of the evening, builds up levels of melatonin, which tells us it's sleepy time and it's time to go to sleep. Well, darkness promotes melatonin production. So blue light also appears that potentially it interferes with that production. So we want the melatonin to go up. Darkness gets us there, but blue light might interfere with that. So there was this whole focus on these blue light glasses. And there were some studies that show that reading a book is better than, your iPad. And if you wore blue light glasses, maybe that would help. And so there was an excitement around blue light glasses. But recent looking at the evidence, and even experts like Matt Walker have changed their view. And now what it appears is it's not the blue light per se. It's that blue light comes in your phone and your iPad. So people who are on their iPhone and their iPad are being exposed to blue light. Yes, but really the issue is the agitation, the excitement of looking at your social media, looking at videos, looking at your email. So when you're ready to go to bed, you've been agitated for hours and you're not able to fall asleep. So it likely isn't the blue light blocking glasses or the blue light, but rather the agitation that's associated with that. Okay, lots of information, but where do we go from here? Where do I net out? We all want to live long and well, and of course, me too. Is light therapy the answer? Well, if you're talking about white light, ultraviolet light, for known skin problems or depression or getting a better night's sleep, the evidence is pretty darn good. And I think it's supportive. Red light therapy, I don't know. For hair regrowth, the data is pretty good. Not the only way to solve the problem, but that's a possible thing to consider. But as we go deeper and hope that they'll do things deep in our bodies, that's where I'm not convinced about the evidence. And finally, blue light glasses. Again, focus on being quiet before you go to bed, reading a book, not having anything stimulating. That's the secret, probably not blocking the blue light. For me, I also would ask the question, is it worth the cost? As I reviewed for some of the studies, there are alternatives. For acne, you can, of course, use benzoyl peroxide or other kinds of things. For fibromyalgia, you can do exercise. Is it worth spending hundreds or thousands of dollars on red light boxes or the laser light therapies? You'll have to decide. And always, is it better than other approaches? Yes, it might provide some benefit, but other approaches may be just as good or perhaps better. So what do you do with this? Well, if you are intrigued and you want to try this, by all means, do so. But maybe think about doing it in the context of an N-of-1 trial, meaning you're going to measure something at baseline. Doesn't have to necessarily be the counting of hair follicles in a centimeter, but think about something you're hoping will get better. Then try the therapy if you wish, measure it again to give yourself some belief that it is real, and that maybe you then stop the therapy, see if the problem comes back, restart it. That will help you figure out how much of this might be the placebo effect and how much might be real. As always, until next time, if you like this podcast, please share it with your friends or write a review on Spotify, Apple, or elsewhere. Take the quiz if you haven't and figure out your health type. And if you want to work more directly with me in all these cases, just go to my website and you'll find information that might be useful. So take care, and until next time.